You heard speakers earlier today and on this panel talk about the massive consolidation that has happened across the industry. And that is true, more than has ever happened in the past. And there's safety in numbers, according to some of these folks that are coming together, because the environment is so frothy. They figure if they join together, it will protect them and put them in a better position to deal with payers or employers and so forth. But the problem with this, and whether we do the consolidation component, it's not fundamental change to the business model. The other thing that a lot of these organizations are doing is employing doctors. And about 50% of the doctors in this country today are employed. That's not only primary care physicians, but it's also specialists. And they have beaten a path to the doors of a lot of very large healthcare systems on the specialty side in ways that executives in healthcare delivery organizations never could imagine possible. And my concern is that M&A, merger and acquisition activity, buying practices, is fraught with a lot of difficulty. And the history of M&A across industries, not just healthcare, is fraught with lots of problems, and we have less than a 50% success rate in looking at what happens with M&A. So the changes that are being made, for the most part, there are exceptions, but for the most part, are within the current business model, is what I was suggesting. We make tweaks with incremental changes. We want to hold on to the current model as long as we can, and we're hoping against hope that this new model that's out there on the horizon isn't going to come. And from my perspective, it's coming, it's galloping, it's coming faster than anybody could have imagined, and we need to get prepared today systematically, or we won't be able to survive. And so one of the things that we see is not only the new players, the retail players in this space, CVS, Walgreens, and so forth, and I would see these entities more from a competitive perspective relative to traditional delivery apparatus. But we also see competition coming from entirely new sources. It used to be that we would compete with the institution up the street or around the corner or maybe across the river. And today, you have very large systems, including Mayo, including Cleveland Clinic, establishing affiliates throughout the country. And these have been systems that have been in place, working on these affiliate arrangements, in some cases for over 10 and 12 years. So these are not spontaneous things that have just occurred, but rather have been in place for some time. And one of the things that I think should be most concerning to healthcare executives across the board is this notion of medical tourism. Let me give you just a couple of examples of what that looks like. In this country, one of the big money makers for hospitals have been orthopedic procedures, including knee replacements, hip replacements, and CABG, coronary artery bypass surgery. Knee replacements in this country typically run about $16,000 a pop. I'm not aware of any discounts if you get two, but about $16,000 a pop. In India, you can get a knee replaced with a clinical staff that has typically been trained here in the United States, with outcomes that are, from what we have seen so far, comparable to good outcomes, excellent outcomes here in the States, for $4,500, about a quarter of the price. CABG, $50,000 here, typical price. In India, about $4,400. Now you might think, who's going to go to India for their care? Well, what's interesting is that increasingly, you've got major healthcare payers who are offering options to their members, all expenses paid, with a significant other, to go to one of these places offshore to be able to get some of these non-urgent care that has been the bread and butter of most healthcare delivery systems in this country done for a fraction of the cost. India, far away. Singapore, far away. Polynesia, far away. These companies are increasingly moving to the Caribbean, and many of them have business plans to come on to the mainland. And so this is happening a lot faster than most people would expect.